From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
Good morning. Welcome to Medical Forum on 105.9. Want to thank Community Broadcasting Company for giving us the forum. Dr. Marr is off today. He's not skiing like the other day, so no casualties. It was good to hear from him last week. For those that did not catch the show or want to catch the show, go to ays/homecare.com. We'll have all of our shows that we've had on. But last week, a little capsulation of it. We talked a lot about diseases that affect the elder that needs bracing. And I want to thank Richard Barkley from Reliable Medical Equipment. Give a shout out to them at 934-9212. So anytime that you have an injury, it needs bracing with an orthotic, Richard is your guy. So I want to thank them. Also want to thank, again, At Your Service Home Care for giving us the forum to talk about all medical issues. Catch them at Wilson Hall Road, 1250 Wilson Hall Road. Phone number 803-607-9677. And today, we've had about 50 shows, and this will be the first show that we're going to talk about our eyes a little bit. And I can give a personal story, and I've got my personal. Can I call you that, Dr. Steve?
Sure,
He is my personal doctor of my eyes, and I have a cool eye. He will tell you that straight out. He probably has no patient like mine. But being dumb back in my high school days playing tennis, I got drilled in the eye with a tennis ball. And it's literally, we all have, we probably have all had our eyes dilated. Oh, yeah. Dr. Dean, mine just happens to do it all the time.
It does.
So, but anyway, we have Dr. Steve Dean in from Rubin, been a real pillar here in the community. Steve, take us through, how'd you get to Sumter? What made you want to become, most people call you the eye doctor.
Yep.
What's the terminology we got here?
I'm an optometrist, that's right. And golly, I've been practicing since 1999. And
yep.
I was one of these kids that always thought eyes were cool.
Yeah.
It's just one of those things, always kind of amazed by it. And one thing that was interesting is my father actually developed an eye disease called glaucoma, and he developed that back when I was in my 20s. So I would go to see his optometrist and watch him get treated, and I just thought that was just really, really neat, how he was being able to take care of by his physicians. And from there, it just kind of progressed, had more of an interest of it. I went to Southern College of Optometry.
Now, where is that?
That is in Memphis, Tennessee.
Yep,
Elvis. That's right, man.
All right,
That's
like
right.
It.
Hey, I went to Memphis, Tennessee in 1995.
And you can't sing a lick, can you?
That's right, a little bit.
Okay, good. All right. So in Memphis, Tennessee, going, what's an undergraduate for people, maybe our younger crowd listening out there, because I do think optometry is very cool. I give my personal story, dealing with all the idiosyncrasies. And today we'll probably focus a little bit more on the elderly because we try to do that. But high school, obviously we get through high school. Go off to college. What was your undergrad?
Majored in biology. Got my BS in biology at Pembroke State University in North Carolina.
Right.
Minored in chemistry. And then...
So if I'm a 21-year-old graduate, well, let's take that back. Mm-hmm. I'm a high school kid graduating, and I want to follow in Dr. Dean's footsteps. What am I looking? I'm looking at probably a 4-year degree in something in the sciences, biology, chemistry.
That's right. Yep.
And then how many years before I get the jacket?
So you do your 4 years undergrad, and then you go to optometry school. That would be 4 years.
Now, let me ask you this. When we say Dr. Dean, mm-hmm. It's not just doctors of eyes. When you do your first 4 years, and if I'm wrong, my understanding is you're competing with the same way other doctors that'll be doing other things. I mean, meaning have you declared your major at that point, or your specialty? Yeah.
So at that point you are enrolled in optometry school.
Yeah.
So all of those graduates would go out to practice specifically optometry.
Okay. So you've chosen that. We've done our 4 years of undergrad, and then we have said that's our specialty coming in. All right. H. Rubin, which has been here. You've been my doctor probably since 1999, 2000. Is that a franchise? Do you own this business?
I do own it. Yep. That's actually what brought me to Sumter. So I started practicing in 99.
Okay.
I was practiced in Columbia for a couple of years and then had the opportunity to buy this location, and that's how we wound up here. And it's worked out real well. So
Great.
We've grown over the years. And
Speaking of growing, well. Kids now are how old?
12 and 14.
No way.
12 and 14.
See, mine are 18 and 16, so get ready. I remember when our little kids, you had toddlers and I had little 5-year-olds and stuff, and of course they come and see you as well. So let's talk, as we probably got 2 minutes left in this first segment. Let's talk about all the things that are offered there to everyone. I mentioned my daughter. You, in my opinion, and we can talk about some of the equipment. You made a diagnosis on my daughter that might have saved her life. So I'm always grateful for you. It was a real rough time for us as we waited, as you sent us off to a specialist. Fortunately, it turned out very benign given everything, but it also could have been a brain tumor.
It could have.
So that speaks to the equipment you have. That speaks to your expertise. So children, adults, male, female, the whole gambit, right?
Yep, we see them all.
Yep. Insurance. Everyone out here listening wants to know.
Yeah.
And
we do a lot of third party. That's just a growing part of the healthcare modality now. So we take a lot of different insurances, a lot of Medicare plans, Medicare replacement plans, Care Improvement Plus, TRICARE for Life.
Yep. Dr. Steve Dean with us, H. Rubin, 775-7877, right there in the mall. All of you've walked by it, so let's talk about the glasses real quick.
Sure.
You have probably as big a selection as anyone.
Yep.
So you fit everyone, bifocal.
Oh, yeah. And that's my thing now. Hey, I'm 44 years old now, so I'm seeing myself. You can't read the little writing anymore.
Gosh, I fake it. You know that.
Yep.
I fake it in your office. I still hate. I always talk about it's great because Chris Marr is my physician, and I hate going to see him medically, but he does such a great job, as you do. AARP, First Choice, Farm Bureau, TRICARE, the Gambit, Medicaid.
Yep, Medicaid, and a lot of Medicaid replacements. Blue Choice.
Yeah.
We do a lot of the Unisons, Molina. We try to see as much as the community as we can.
HMOs.
Yep.
You know, another thing I like about your business going there as well, Kathy, she's been there forever.
Oh, yeah.
Very little turnover at your place. That tells me a lot of things. It tells me you're a heck of a good guy who owns a business. It tells me that everyone there is committed to what they're doing, and they must be doing a pretty good job with you.
Yeah,
so
I'm very fortunate, very fortunate.
He is, again, Dr. Dean. We're coming up on our first break. When we come back, we're going to talk about some of the elder problems that you see, and some of the diagnoses, and some of the equipment they use to diagnose, and then what are our ways to alleviate these. So we'll be back. It's Medical Forum. Thank you all. And again, I want to thank all of our sponsors, MediHome, Toomey Hospital, Reliable Medical, and of course, At Your Service Home Care.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto Owners will save you money on all of the insurance you already have. Now that's good policy. This is Sandy Wilson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
At Your Service Home Care provides in-home personal care, including light housekeeping, bathing and dressing assistance, medication reminders, meal preparation, companionship, transportation, and assorted other assistance to continue living safely and comfortably at home. At Your Service Home Care works with your local home health, hospice, Alzheimer's and VA programs, and other providers in the Sumter, Clarendon, Lee, and surrounding areas. Locally owned, At Your Service Home Care is here to ensure you and your loved one continue to live your life with dignity and respect. At Your Service Home Care, 1250 Wilson Hall Road, Sumter, 803-607-9677. Please call, stop by the office, or visit www.ays-homecare.com and let them know how they may be of service to you and your loved one.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
This is Medical Forum, presented by At Your Service Home Care.
Good morning again. We're back. Medical Forum. I'm your host, Jeff Reed, without host Chris Marr today. He is practicing, believe it or not, on a Saturday. Practicing what? Probably chipping. But I know Chris always works on the weekends, and I think he's got a little bit of duty down at that urgent care center. In the house today, Dr. Steve Dean, Rubin Vision Center. Been here only about 18 years, so if you haven't caught him, you're the only one. We got the background. We've got what, and I find anyone who's great at what they do, passion and the desire to do something. Very fortunate for you. It sounds like at a young age, you got exposed to something, it hit home with you, and the rest, they say, is history.
It is.
18 years of school later, it's history. All right, let's talk about our elder population. Great. And we've talked about all the things that's offered there, from checkups to eye care to contacts. Let's talk about the interaction between a physician, if need be. Let's talk about Obamacare, if that's been a positive influence on your end of it. It gets a lot of bad, but then there's also some other good that we hear from it. And let's just talk us through. I'm a Medicare patient. Obviously, we encourage everyone to come in once a year. So, absolutely. I'm 65. What happens? Do I need to see Dr. Dean under most circumstances? Can I come unilaterally, or must I go through my primary physician?
Absolutely, you can come in. Everybody, when you get basically 50 and up, you need to get an eye exam every year, particularly if you're diabetic. The big push in healthcare is diabetes, basically. There's a better coordination between eye care, eye doctors, and medical doctors. So, for example, if you're diabetic, and let's say, for example, you've got Medicare, you come in and you see me, and then I want to make sure that there's not any diabetic retinopathy. And that is a big health concern moving forward. I'll tell you, in 2000, there was 4 million diabetics that were diagnosed with diabetic retinopathy. Now, diabetic retinopathy means that the diabetes has gotten out of control. There's bleeding going on in the retina all the way in the very back of the eye, and that's how diabetics go blind as a result of their diabetes.
Okay, because this is a huge part. Our show, we probably had, Dr. Dean, probably 4. If we've done 50 shows, I would say a quarter of it, the word diabetes has come out in some form or fashion. Now, at the beginning of the year, this year we had Missy Reese on from the YMCA, and we talked about all the problems, and they're a big backer of trying to prevent diabetes on the front end.
Right.
Owning reliable medical equipment, we probably fit 500 diabetic shoes. And for those that aren't diabetic, they look and go, well, what does this have to do with shoes? And we've talked about neuropathy and loss of I guess blood flow, we'll call it, to the legs, and with that, the diabetic shoes and the prosthetic limbs. Now, I'm a novice in your field. Why is blindness something that we also see at Reliable Medical when they come in, they've lost a limb. We get that. You used a real big word. I'm a very small word guy. Diabetic.
So diabetic retinopathy.
What is it?
What that is that's basically eye disease of the retina. We're talking all the way in the very back, the part of the eye that you see out of.
Okay.
All the way at the very back where light focuses in the back of the eye. That tissue is called the retina. Now what happens is you've got these blood vessels. You've got these branch retinal arteries. You've got these branch retinal veins, and those supply blood to the very back of the eye. Now what happens in diabetes is when the blood sugar gets way out of control, those blood vessels start to leak, and they start to hemorrhage, and you have bleeding. And it's that bleeding that will cause blindness. And then, and with that, there's also a higher incidence of other complications. For example, there's another eye disease called glaucoma, and there's a higher incidence of glaucoma with diabetic patients. So it's a whole multifactorial type of situation.
I come into your office. I'm diabetic. I understand. I've met with my diabetic physician. Taking insulin. I understand sugar, as we call it down here in the South. Been down to other places, and they've told me with my foot, this is why I have neuropathy and I can't feel my feet. Now I sit down in your chair, and I complain that my vision has gone a little awry, and I assume that is one of the problems. I'm not seeing the way I used to. What device do you use? Is this just simply looking and you can see it all the way back as if you're doing a normal, or do you have certain...
There's a lot of things we can do. So one is we're always going to want to make sure that we get a good dilated eye exam. So we're going to put some drops in the eyes. We're going to open up the pupils really large, and that'll give us a much better look at the very back of the eye.
All right, can we stop on that? Because I think a lot of people wonder why they have their eyes dilated, and what advantage does that give to you on diagnosis, whether you're diabetic or not? I'm just curious, as a guy with a permanent dilated eye, what does that do? When you dilate, what happens?
So whenever a patient comes in, when you do a dilated eye exam, it is a much more extensive health examination.
Okay.
So when you dilate the eye, you can see the optic nerve much better. You can see the peripheral retina much better, making sure there's no tumors, no retinal holes, detachments, bleeding, hemorrhaging. You can take a much better look at the lens to make sure that there's not any type of cataract starting.
Okay.
So it is just a much more detailed and extensive
So
health.
when we all cringe and hate it in our eye and it stings a little bit, and then we get those cooled glasses that you give us for the next 2 hours, and we feel like our depth perception is from here to Mars or what have you, there is a method to why we're doing this.
It is a necessary evil.
Okay. So now back to diabetes, because I'd like to spend another couple minutes with that. How often do you see that?
Every day. Absolutely, every day. The incidence of diabetes in the U.S. is it growing? It's really an epidemic. It is. Like I said, in 2000, there was 4 million cases of diabetic retinopathy. In 2010, there were 7.7 million, and that's going to double in 2050. Yeah. So, eye disease that relates to diabetes is going to continue to get worse and worse, and it's just because there's more diabetics.
Well, let me give you a stat on diabetics in the world. Dr. Lily Vivat, who I would consider probably as top-notch, knowledgeable on this, 27 million people diagnosed with diabetes. Well, excuse me, let me take it back. Walking around with diabetes, 21 million diagnosed, 6 million that don't have a clue that they have it. So what you're telling me, of the 21 that come in, man, like 1/5, you usually have some problems with their eyes.
That's right.
Wow. How many times do you catch it first? And then you go maybe I haven't seen my doctor in a year or two. I come to see you because I'm having troubles with vision, or I have an injury, and you find it.
We do that a lot, every day. Yeah, so there's a lot of times they come in for just the patient comes in, their vision's a little blurred. They think all they need is maybe just a new prescription for glasses. And you get in there and you dilate the eyes and you...
Voila.
Yep, and there it is.
He is Dr. Steve Dean, H. Rubin Vision Center, located very conveniently in the mall, 775-7877. And when we come back, we'll touch a little more on diabetes, but I also want to move on. Hot topic you brought up was Glaucoma.
Glaucoma.
All right, we'll talk about that when we get back. Thank you.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports. WDXY 1240 AM and 105.9 FM.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto owners will save you money on all of the insurance you already have. Now that's good policy. This is Karen Schwartz with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
I was Daddy's girl. He was my guide, confidant, and friend. We cooked out, fished, and talked about everything. He has trouble remembering those times now. I'm the parent and caretaker to my dad. He does remember losing his dignity each time he needs my help with simple daily care. Calling At Your Service Home Care was the best thing I've ever done for my dad. His personal attendant provides assistance with bathing and dressing, a compassionate presence for his safety, and even travels with our family. Having At Your Service Home Care working with me now gives my dad his dignity, and I can enjoy just being his daughter again. The wonderful people with At Your Service Home Care have the gift of caring for your loved one. If you have become the caretaker to a parent like me, contact At Your Service Home Care, 803-607-9677. Located at 1250 Wilson Hall Road in Sumter, or visit the website www.ays-homecare.com.
This is Medical Forum, presented by At Your Service Home Care.
And we're back on Medical Forum, just having a good time in between breaks with Dr. Steve Dean at H. Rubin. And Dr. Dean, when we left, diabetes is, if we've done 50 shows, we've talked about it probably 10 times between Dr. Lily Vivat and we had Michaela Smith in from Carolina Diabetes talking about nutrition. We've had people from the YMCA who big benefactors of it. Jeff Fall from the foundation. I think epidemic was a very accurate word. 27 million people probably walking around with it, and unfortunately, only about 21 of those million have been diagnosed. So, if you feel these symptoms, lightheadedness, you're just not feeling well. If you kind of have the physical symptoms, a little overweight,
extreme thirst,
a lot of urination going on. And when we left, we were talking about you sometimes are the first bearer of bad news.
Absolutely.
Yeah.
So, we see a lot of them. Patients come in and they're experiencing blurred vision, or they just know that something's not quite right with their eyes, and we can certainly take care of them early. And it's all about prevention. The earlier that it's caught, the better the outcome's going to be.
Now, with the rest of what we talk about when we look at medical equipment, when we look at someone at the YMCA, how much of it is changing some lifestyles? I mean, we know type 1, we've been dealt a bad hand. Type 2, are you coaching them up there too on diet, sugar?
Absolutely. Yep. If you're a smoker, you got to quit smoking.
Okay.
You need to, get in the wild a little bit more.
Is smoking probably the worst thing you can do?
Smoking is absolutely the worst thing you can do.
Okay.
You gotta quit smoking. You gotta take care of yourself, exercise more, cut down on the carbohydrates.
Yeah.
And smoking. There's absolutely nothing that smoking does that's good for you.
Isn't that crazy? Unless you own a company that sells cigarettes.
That's
Steve,
right.
And in
that's
that
right.
case,
yep.
Yeah. Oh my gosh! All right, glaucoma was brought up very early in this. I've heard of it. I know people who've had it. give me a description of glaucoma.
So glaucoma is a disease of the optic nerve. So in the very back of the eye, there's a nerve called the optic nerve. So all of the information from the back of the eye goes down to the optic nerve, and then from there, that information shoots from the nerve to the brain, and that's basically how humans are able to see and function. So in glaucoma, that nerve basically starts to die. It starts to degenerate. And the most prevalent form of glaucoma is called open-angle glaucoma. Basically what that means is that basically the pressure in the eye becomes elevated. You know how some people have high blood pressure.
Okay.
Well, some people can have high eye pressure. The actual pressure in the eye becomes elevated. That high pressure will actually cause the optic nerve to degenerate. Will start causing it to die. And as that happens over time, the individual will start to lose their peripheral vision.
Okay.
So not central vision, it'll be their peripheral vision. And very, very slowly, over time, it'll get worse and worse and worse until the end stage is complete blindness.
Does blood pressure enhance this? Or is there no correlation? It was just more of a...
There's really not a big correlation between blood pressure and eye pressure. Okay. However, patients that have small vascular disease like hypertension, like diabetes, there is a higher incidence of glaucoma in those patients versus the general population.
What's a symptom
of glaucoma?
Can it just come upon me? I don't...
This is the thing about glaucoma that is so scary. There are no symptoms.
Nothing.
The only way it can be detected is through an eye exam. The vision loss happens peripherally. And the thing is the vision loss happens so slowly over time,
you don't even
know it. And by the time that you realize that your peripheral vision is gone,
yep,
the nerve's just about
dead.
And
unless you're an athlete or a race car driver, for the most part, we don't use our peripheral vision that much. Even when we drive, we use our mirrors. We turn our head. So, like you said, by the time I look up and realize that my peripheral's actually bad, I'm more conducive to considering that status quo. That's normal.
Yep.
Does it affect, what's an age group that really should be tested for this if there's not already doing it?
Obviously, there's a genetic predisposition for it. African Americans have a much higher incidence of glaucoma than Caucasians or Hispanics. And the disease usually starts in the late 40s.
Okay.
So
what's my cure?
There's several things we can do for glaucoma.
Okay.
So glaucoma, there's several different drops and that can be applied. I have a lot of glaucoma patients, and they do great.
Just simple drops. Eye drops.
You put a couple of drops in your eyes. It keeps that pressure low.
Yeah.
And as long as you come and get the testing and let me monitor it, most of them do great.
Yep. Are headaches a problem? It just sounds like I would have a headache. I'm thinking about just a thumping when we talk about swelling. Really, there's not that many symptoms.
The pressure, in order for the patient to be symptomatic where their eye would actually ache, the pressure would have to be extremely elevated, very elevated.
I catch you late. I hear you on the show. 10 years from now, I finally go and I see you, and you say, like, for example, on cancer or COPD, there are first stages and there are late stages. So a gentleman who refused to come in for whatever reason, is there a late stage glaucoma where you say, man, if I'd have caught you earlier, these eye drops, and you're going, okay, now how do you fix me? Or is it too late?
It's too late. It's all about prevention. So we're talking about the degeneration of the optic nerve. When the nerve's dead, it's dead. When the nerve's dead, it's gone. It's almost, think of it like someone that has a spinal cord injury. When it's severed, it's gone.
Yeah. Or, we look at that with diabetes.
Yeah.
I mean, when people don't understand, well, why do you have his leg amputated? His foot it's dead.
Right.
It's black. It smells. It has died. You talk about that it gradually comes to where it becomes status quo that I just don't see well in my peripheral. When you get to the stage that maybe we're not at the beginning stage, but we're not at we'll call it terminal stage where you can't do anything, is that noticeable?
Yes.
Okay. So now I'm just being stubborn, and I either, I can live with this.
Yep.
Wow.
If the patient is really kind of aware, at that point they'll be able to notice that they can't see as well peripherally, maybe in the right eye versus the left eye. There can be some gross things that can be picked up on examination.
So I could be okay in my left or not as bad, but in my right. But when you say there's nothing I can do for you, both eyes now have gone to that. Have you ever had an instance where you say, okay, left eye, we got a chance. We're putting drops in here. Yep. I think we can get some of that vision back peripheral in your left eye.
No, you can't get it back.
You can't.
No, when that peripheral vision is gone, when that nerve is dead and that peripheral vision is gone, it's gone.
Gone. Can you have it gone in one eye and not in the other?
Usually glaucoma happens bilaterally. However, it's usually more progressive in one eye versus the other.
Wow. Gotcha. He is Stephen Dean. H. Rubin. Man, they take every insurance, so you need to get down there. But just a wealth of information. If you haven't been in there, just in the last 2 years, as we come up on a break, Steve, maybe we'll talk about some of the equipment that I've seen you put on that in the last 4 or 5 years that do a tremendous job. So we're out for prevention. Dr. Steve Dean, and we'll be back right after this message.
Back with more on Medical Forum, presented by At Your Service Home Care.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and a voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all your insurance needs 24/7. Now that's a good policy. This is Ed Bynum with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Brooke Luce, Admission Instructor with Sumter East Health and Rehabilitation. Our primary location is at 975 Miller Road in Sumter. We offer short-term rehab and long-term care. Our specialty physicians and rehab team will work in partnership with your physician to design a rehab program geared towards your specific needs, including chronic weakness, reducing pain, chronic wounds, stroke rehab, and much more. For more information, please call Brooke Luce at 803-840-7515.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
And we're back. It's Medical Forum. Thank you all for listening in. 105.9. It's a talk radio here. Sumter, Florence, Lee County. Venture into Kershaw a little bit. And parts of Columbia. Want to thank Community Broadcaster for giving us this forum to sit and talk and hopefully educate on all medical issues in any of the upcoming events and such that center around medical. Our guest today, Stephen Dean, Dr. Stephen Dean with H. Rubin Vision Center, 1997. Wow. Yeah. Time goes on, man. 775-7877 at the Sumter Mall. You can't miss it. Talking about diabetes, talking about a lot of key words in your neck of expertise. We talk about cataracts. That's something that I'd like to discuss.
Yeah.
What is cataracts?
You know, that's a great question. People ask me that every day, saying exactly what is a cataract. So basically, inside the human eye, you have a structure called the crystalline lens. So everybody has a lens inside their eye that helps focus light on the very back of the eye called the retina. So what happens with cataracts is basically that lens becomes hazy.
Okay.
It's basically a haze and opacity that happens in the lens, and it generally starts in the late 50s, early 60s. And
is this when you take that awful light of yours after you've dilated my eye, which we all know what that does with glare? I'm assuming this is a good reason you're doing it. It's not just something you go home and giggle with the family. All right. Is that to help identify cataracts?
Absolutely.
Okay, so this is one of the main purposes for that. What are some of the symptoms for cataracts?
Okay. So the first symptom of cataracts basically is people will notice that they're having vision issues.
Okay.
Their vision isn't as clear and as sharp as it used to be. And they'll also notice a lot of issues with glare, problems of driving at night. They'll see halos around lights. And that's from whenever light actually comes into the eye, it hits that fuzzy lens, that hazy lens, and it causes the light to basically diffract. So that's why you're having a lot of issues with glare, halos, problems night driving. And that's a big symptom of cataract. So what you do is you kind of watch that, and when it comes to the point where the cataract becomes surgical, then we would send the patient to a surgeon, have the cataract surgery done. I would do the follow-up care, and it's a very easy procedure.
So
do real well.
Usually attacks both eyes pretty evenly. Okay, so now it's been diagnosed, but you let me out of the office. You say, oh, we're not there yet. And I'm sure with most insurances, there has to be a certain level before they pay for it. Right. Is that a fair statement?
The rule of thumb for most insurance covered carriers is when the visual acuity drops off to around 20/40. So basically, if the patient can be corrected to about 20/25 and isn't having a lot of glare issues, most people just kind of correct it with glasses. When it gets to the point where it drops below that 20/40 mark, then at that time it becomes surgical, and we'll consider having surgery done.
Okay. Possible to have one eye that is eligible for surgery,
right?
And which insurance helps pay. But the other one's not.
That's right.
So what do I do? Do I have to say, okay, you're going to get one done, and you're going to pull the other one out of your pocket, or do we wait and risk not driving at night or causing wrecks, or does it become a time when, let's just say, for example, my license is coming up? Would that be something that would probably keep me from passing, or would the glasses sustain that?
That's a great question, because that happens. That's like every week.
Yeah,
people come in. So right. So what we would do at that point, we would send the patient out for cataract surgery when the eye that's surgically necessary. Okay. You'd have the surgery done, and then we would just follow the other eye to the point that it becomes surgically necessary.
Okay.
And send it out. But there's a lot of times the patient would go and have surgery in one, and they'd still have a cataract in the other, and we could just correct their vision with glasses the best we can.
Okay.
And then just kind of wait until that that cataract's ready, and then we could get a form fit out from the DMV and get them driving and get them seeing.
Yay, that's what I want. One more person in my way who can't see. Thank you, Dr. Dean. Question, do you do the surgery? Are you a surgeon?
No, I'm not a surgeon.
So you're the first line of attack here.
That's right.
And then what we always talk about here, Dr. Marr and I think we have some of the finest physicians here in town. I don't think there's any reason to leave Sumter if you're having a knee replacement, if you're having any kind of surgeries done. You are like a Dr. Marr in that respect. You are seeing it. You're working with the physician. There comes a time when it's time to go see the expert. Good referral sources? Do you feel like?
Oh, yeah.
Good. And I mean, look, sometimes it's best to go to Columbia, Florence, wherever the case, because they're just not.
We got some great surgeons here in Sumter. So we do everything. We try to keep everything local. And we'll send patients. I actually do a lot of surgery with James Goodson and Gregory King. And
very good.
Great job.
Dr. Goodson. So cataracts, I think we now have learned. So cataracts, it is surgery. There are certain times when we should see it. We see age coming. We see symptoms, which is nice, as opposed to the glaucoma, which just kind of jumps up and catches us a little bit. Let's talk about a subject that I hear a lot. And I think sometimes there might be some or some misconceptions. And I know it's not something that you do in your office, but I know that you do help, I guess, in some of the treatment. That's LASIK. Mm-hmm. This is the briefest surgery in the history of the planet, to my knowledge. It's like 19 seconds, is it not? It's something ridiculous. Yeah. My niece works for a surgeon who does LASIK surgery, and I think he does like 10 million a day and still plays golf. No, I mean, all right, talk me through a LASIK. You're identifying, again, you're the first line of defense.
You're right.
Is it kind of maybe some vanity here in this, or it's a choice of glasses and contacts?
Most of it's cosmetic. So okay. Basically, a patient, say they're nearsighted, say they can see great up close, but they just can't see things off at a distance whenever they're driving. Maybe they're tired of wearing glasses or contact lenses, and they want to have a surgical correction. LASIK is a great alternative for those type of folks. So basically what it is, it's surgery on the cornea. You're using some instrumentation to manipulate the cornea, and by changing the shape of the cornea, you're redirecting light to focus onto the retina, and that's basically how that works.
And an elective surgery.
It's elective.
There's no reason for insurance to step in when they can do something. Usually for people that I try to coach people up on insurance, insurance will look at what can correct a problem the least expensive. They're not really looking at, wow, wouldn't that be cool if I don't have to wear glasses or whatever. Wait, do glasses work? Yeah, then pick out those glasses. Whoa, but I like, those are really cool glasses. That's fine. These work. They're not as cool, the surgery and such. We're coming up on a quick break here. We are with Dr. Stephen Dean with H. Rubin. We were talking about LASIK surgery. We might come back after break and talk just a little bit more about that. I think got a couple more questions for you on that, and we'll be right back.
Sure.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
This is Brooke Luce, admission instructor with Sumter East Health and Rehabilitation. Our primary location is at 975 Miller Road in Sumter. We offer short-term rehab and long-term care. Our specialty physicians and rehab team will work in partnership with your physician to design a rehab program geared towards your specific needs, including chronic weakness, reducing pain, chronic wounds, stroke rehab, and much more. For more information, please call Brooke Luce at 803-840-7515.
Reliable medical equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine, and they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your insurance policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all of your insurance needs 24/7. Now that's good policy. This is Bubba Johnson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Medical Forum, presented by At Your Service Home Care.
We're back with Dr. Steve Dean. When we left the last segment, we were talking about macular degeneration and differentiating it from like glaucoma. And if I'm understanding, glaucoma kind of affects our peripheral vision just a touch more, or else I mean, where this straight on, right down the middle,
Right.
Which I think is very scary, obviously. Family history always plays a part, it seems like, in things that we do, whether we're talking about cardio problems or we're talking about obesity, even addiction problems, I would think. This is no exception. So look at your family history. Obviously, it starts and stops, again, seeing your doctor, in your case, Steve, seeing you, getting at family history. That's why we always have everybody fill out everything, because now we know what we kind of want to look for. A multivitamin, which most people associate that with commercials of people that maybe are working out and running and having a multivitamin to help with, and you mentioned free radical and things like that. How does a multivitamin help in this?
So with macular degeneration, let's kind of back up a little bit. So macular degeneration, again, is a disease that affects the central vision. When we were talking about glaucoma, we were talking about that there's a higher incidence of glaucoma in African Americans. Well, with macular degeneration, there's a higher incidence of macular degeneration in Caucasians, people with blue eyes of Scandinavian descent.
Okay.
And so what happens in that disease is that the retina starts to degenerate, and there's a lot of multivitamins that will help protect that. So basically what it'll do, the multivitamins will help decrease a lot of these free radicals that are kind of helping destroy the retinal tissue. And it'll help stabilize that. Now, it's not a cure-all. All it is that's the best thing we can do to kind of help slow the process down.
So we're slowing it down, and now we've gotten to a position where, what? Am I going to go blind?
Sometimes
am I going to have
happens.
surgery?
Sometimes
is there a surgery?
So what happens is with, like I said, there's two forms of macular degeneration. There's the dry form and there's the wet form.
Right.
What we're trying to do with multivitamins is keep it dry. Gotcha. Now, if it converts and goes to wet, at that point, I'm going to refer you out to a retinal specialist, someone where that's all they do is retina. And there are different procedures that can be done. There's different injections that they'll actually inject medicine actually into the eye to try to decrease the new vessel growth, the bleeding, the edema. But like I said prior, 70% of the patients that have wet macular degeneration are legally blind. So if we can keep it from getting to that point, it's all about prevention.
Well, and one thing that we said at break, we were talking about when we think about blood and it's bleeding, that's not a description, that's a reality. So when you're looking through there, and I think your observation, well noted, was you may have the only profession where you actually, without opening up and doing exploratory surgery or something like that, you can see it bleeding.
Absolutely.
So when we're wondering, wow, what's giving this guy stomach problems? And all, we open up, oh my gosh, he's bleeding internally. You can go through your series of tests from the dilated eye to looking through with the scope, the visual acuity, just all these things help detect that, and you truly are bleeding.
You're bleeding. Yep. See the one thing that I've liked about the eye, the cool thing about the eye, it's the only part of the body where you can actually see live vascular tissue without doing any kind of surgical procedure. So the patients are always kind of astounded when I tell them what I can actually see in an eye exam, and I have to remind them, hey, if you can see out, I can see in.
Wow. Hey, can you see the brain?
Yeah. You can see the optic nerve, and remember, that information from the nerve goes to the brain. And that's actually how I was able to diagnose that issue with your daughter.
Wow. Because, and I won't even make light, I was going to say, I wasn't sure, you finally validated there actually was a brain there for her. No, well, but see, that right there, having her, I think what tipped it off, she plays a lot of sports, and her vision was starting to get compromised a little bit, which I don't think is atypical for a 12-year-old, 13-year-old girl. So to come in and get glasses, for you to do the test that you do, this is why it's so important. You didn't just come in and go, yeah, gross sport, yeah. Through your expertise, but also the help of some of the equipment that you have. Talk us through these last few minutes just about, I come into your office, I'm scared to death. I've never been to an eye doctor. I'm going, my wife's maybe, my kids, my grandkids, or I'm a kid. What's going to happen when I come in there?
Well, we're gonna do a complete and thorough workup. Now, one thing that when I saw your daughter, I have to commend you that y'all were smart enough to understand the value of health care, and y'all opted us to do the actual testing. So I had several years of data of pictures of the very back of the eye. So when she came in that one year and we saw that there was an issue in the optic nerve, that optic nerve was swollen, there was a big red flag. We were tracking it, and we could actually pull up the picture and see that there was a physical change. And at that time, we knew that there was something that needed to be done. So I recommend everybody, if you've never had an eye exam before, this is your first one, you need to get retinal imaging done. You need to have a scan of the optic nerve and the macula done, something called an OCT, optical coherence tomography. That's the big word. But basically, that's like an MRI where you can see actually all the individual cellular layers of the retina. And if nothing else, just for a background, just have a good baseline.
Is this the thing that you did for me? It looks like when it's finished, number one, it's painless. But your eye, it kind of looks like a red moon.
Right. That's right.
I mean, a full moon, by the way, I hope, in most cases. So, all right, so let's get a good baseline. So then when, in Josie's case, you probably had, everything was pretty good the year before, so probably wasn't scheduled to come in for a year.
Right.
But now, had it been 3 years?
Right.
We don't know, So getting get the test done when they're there. Most of them are paid for. If they're not, hey, this is your vision. Right. You got two eyes. Come on. So he's able to also look not only at vision, but you also, when we're somewhat joking about being able to see through the brain, this was as much of a cerebral problem.
Right.
Because of the depth that you could see through as it was a vision problem. But just to bring a good story, one pill, much like your multivitamin, she's 2 years removed from having that swelling, and it instantly brought her back to a state of normalcy.
Oh, yeah. Once we rolled out that there was no mass-occupying lesion, they put her on some Diamox, and she's doing great.
That's right. And she sees that once a year. Yep. She goes up to see the specialist. So, we probably got a minute left here. Yeah, thank you for coming in.
Sure.
Good to see you. Are you still working out as much?
Yeah, man. That's right.
Okay, you're looking good.
You need to come in, man.
Oh, come on. I'm there. It's just different times, Some of us got to work for a living. But he is Dr. Steve Dean. Hey, we're going to do this again because there's so many questions, and there's nothing more important. Cardiovascular, duly noted. But anyone who's can't see or has had their eyes compromised, as I have, for even a short duration of time, there's nothing that you wouldn't pay for. I think the moral of the story, come see Dr. Dean. Let him consult back with your general practitioner, especially if you're one of the 4 or 5 that we mentioned. If you're having troubles with your nearsighted, from your central vision to your peripheral to your diabetes.
Absolutely.
All right. Hey, good seeing you.
Man.
And hey, I'll back to the Y for me.
Yep, there you go.
We'll see you next week on Medical Forum. Thank you.